In a significant leap toward transforming global healthcare delivery, the Santiniketan Digital Hospital Global Mission 2026 will be launched on 5th May in Agartala. Built around a powerful slogan, "Distance is Dead," the initiative outlines a bold vision 2030. In a significant leap toward transforming global healthcare delivery, the Santiniketan Digital Hospital Global Mission 2026 to be launched on 5th May in Agartala. Spearheaded by Positive Varta Foundation, the ambitious mission aims to merge cutting-edge technology with accessible care, setting the stage for a new healthcare paradigm. Built around a powerful slogan, "Distance is Dead," the initiative outlines a bold vision 2030, establishing 100 tele-labs across 20 countries and delivering modern healthcare services to nearly 500 million people worldwide in the next decade. The mission designates Agartala as the emerging digital healthcare capital of Southeast Asia. At the heart of the program are 6 integrated teleservices: telemedicine, telepathology, teleradiology, tele-ICU, tele-education, and AI-powered healthcare system. This services promises to drastically reduce turnaround times, with diagnostic report available within 30 minutes and remote specialist consultation accessible from patient's home. A standout feature of the initiative is the rollout of 10,000 trained women healthcare workers under the AIDD program. They will extend primary healthcare access to underserved and remote areas to ensure affordable availability of essential medicines. Positive Varta Foundation Chairman Malay P said the mission's inclusive vision is not just a delivery health service, rather establishment of healthcare system as a fundamental right. The initiative's next phase will unfold on May 13 in Bolpur, while the Santiniketan Medical College Global Hub will be inaugurated, unveiling the Sundarban digital health model. Bureau Report News Now.